The profession of obstetrics and gynecology is quite broad, and a lot of patients don't realize that. The field of obstetrics is delivering babies. Gynecology manages situations such as polycystic ovarian syndrome, endometriosis, hormone therapy. There is infertility, reproductive endocrinology, and certainly gynecologic oncology. Well, the profession of gynecology specifically has so many areas and avenues to try and tackle as a doctor. Some doctors have a real passion for menopause. If you as the patient have a relationship with your OBGYN for years and you're doing great and you're happy in that relationship, then stay with that doctor. Sometimes, though, patients will get into menopause and their physician's not as comfortable with the knowledge in that area. It is fine to seek out a physician who has an expertise in the area of menopause, learn from that doctor, tackle your symptoms, and then return to your own OBGYN. That is fine to have that relationship.